Hannah did a great job outlining so many risks we face against our physical health due to climate change. It is important to also consider how it may impact our mental health. My name is Julia, and I'm going to be giving you guys some possible ways that mental health may be affected by climate change. One thing I want to point out before diving in is that mental health disorders have the potential to be those with mental health disorders have the potential to be disproportionately affected by climate change. A person already struggling with their mental health may struggle to cope with the added stressors caused by climate change. The first way climate change may impact mental health is through natural disasters. Losing a home or even an entire community to a disaster is an extremely traumatic situation. It can cause anxiety, depression, and post-traumatic stress disorder. Many people affected by disaster experience lasting psychological dysfunction long after the event. Some people more at risk for these symptoms are children, pregnant women, people with a history of mental illness, people of lower economic income, including the homeless, and first responders. Increased exposure to heat is another threat against mental health. Studies have shown a connection between a rise in temperature and a rise in aggressive behavior. Suicide, as well as criminality, have been shown to increase during the summer months, suggesting a link with the rise in temperature. A study from Australia also suggests an increase in admissions for mental disorders during heat waves. Extreme heat has the potential to exhaust a person both physically and psychologically. Another population more at risk could be those who work in agriculture. Climate change will likely lead to drought in the years to come. Changes in weather will cause floods in some areas and droughts in others. Throughout history, there has been a link between drought and an increase in farmer suicide. Failure of crop often leads to economic hardships and has been linked with an increase in suicide attempts among farmers. Next, climate change is going to greatly affect the economy, which is something that will be addressed in another episode coming up. But I do want to take a second to address how these changes can affect mental health. Deterioration of economic conditions has been linked with depression and demoralization. The loss of capita poses a higher risk among women to deteriorate mental health. Also, in times of economic trouble, the ability to seek help for mental health diminishes greatly due to financial constraints. If a person has to choose between finding treatment for their mental health and putting food on the table, seeking help is not a true option. Another way climate change will affect mental health is through forced migration. Climate change is going to affect different areas of the world vastly differently. This is likely to lead to forced migration as people must flee the most dangerous parts of the world. Research has shown that migration leads to acculturation stress. Acculturation stress is the mental and emotional effects of adapting to a new culture. This stress can lead to the development of other mental disorders. Those who are forced to relocate have shown a much larger deterioration of mental health when compared to those who did so voluntarily. Finally, earlier, we outlined some of the ways physical health may deteriorate as climate change progresses. Physical health can also have an impact on mental health. Poor physical health can lead to poor quality of life, in turn creating psychological distress. Depression and anxiety are often the consequence of physical illness. We need to increase access to mental health services to mitigate these effects of climate change. Mental health is likely to be overlooked when so many other adaptations are taking place, but it is extremely essential. In the future, having proper coping mechanisms and support systems will be even more essential to maintaining mental health.
Thank you, Hannah and Julia. Climate change has undoubtedly caused extensive harm to individuals both mentally and physically, and what is currently being done to address climate change is not often talked about. Here are some little doses of hope. A study performed by researchers at Northeastern University and Yale found that hospitals and other healthcare facilities are responsible for about 10% of all greenhouse gas emissions. According to the Climate Council, hospitals can reduce their carbon emissions by providing healthier food, investing in cleaner energy, greening the operating room, purchasing environmentally preferable goods, producing less waste, being resilient to weather extremes, modifying transportation, and providing leadership. Here are some examples of things that have been done already. First, by implementing a cafeteria food waste minimization program, Gunderson Health was able to reduce pre-consumer food waste by 80%. Second, due to the 24/7 operating times of hospitals, $9.6 billion is spent on energy every year. Advocate Healthcare was able to reduce its energy consumption by 23% per square foot from 2008 to 2015, which saved $23 million and avoided the release of 203 metric tons of carbon dioxide into the atmosphere. Next, operating rooms are responsible for 20 to 30% of the hospital's total waste. Furthermore, desflurane is used as an anesthetic and is 2,000 times worse than carbon dioxide. In its attempt to achieve net zero greenhouse gas emissions, Boston Medical Center installed all LED surgical lighting and occupancy sensors and discontinued the use of desk flooring in their operating rooms. Due to the upstream supply chain, products and services purchased account for 60 to 80% of the greenhouse gas emissions. Intermountain Healthcare reduced overall waste by 20%, which cut labor costs and its carbon footprint, simply by implementing a closed-loop shipping system. On average, 30 pounds of waste are produced per patient per day. To limit waste production, Health Partners implemented a waste reduction program. This diverted 166 tons of food from the trash to compost and recycled 1,500 tons of materials, which saved the company $1.3 million. Even in extreme weather, hospitals still must function. So, Partners Healthcare from Boston made its Spalding Rehabilitation Hospital facility for emergencies when the sea inevitably rises. The carbon emissions due to the transportation of employees and patients is of great concern. According to the World Health Organization, 9 out of 10 people reside where air pollution is unsafe. This can contribute to medical conditions such as asthma, heart disease, cancer, etc. To address this issue, university hospitals funded a citywide public bike sharing program called UH Bikes out of Cleveland, Ohio. This avoided the release of 6 tons of carbon dioxide into our atmosphere. Finally, leadership is required to move the healthcare system towards a cleaner reality. Innova has used their website to educate patients and communities on the impacts that climate change has on health. Even though the ramifications of climate change are severe, we can be optimistic that the discussion of our warming planet is becoming prioritized in society. We hope that you will make good use of the information that we provided to you in this segment, and we will see you on our next episode, Natural Disasters and Their Impact on Habitats. Thank you.